And you might question yourself, hyaluronic acid on the market, stem cells within the cytocare. So cytocare for me is the best media for wrinkle, starting in the periorbital area here. We will treat all crop fits here wrinkle, doing superficial injection within each of these wrinkles. And I also love to treat this darkness of the trough using cytocare. And we could also inject these wrinkles from the contraction of the nasalis muscle on the nose that could be injected. So we will treat for this lady all periorbital area, and then we will also inject the wrinkle on the neck, doing superficial puncture injection to treat these wrinkles. So as you know, these are multivitamins, amino acids, so it has to be repeated. It's not a one-shot treatment. So, and this one is the new on the market. It is 18 milligram with the 50 component rejuvenating complex, and it comes in a 3 cc syringe with a 30 gauge needle. So that's the one we will use. So please, if you have any question on the floor in the audience, you can just make it interactive. It's better than ask at the end.
Okay.
Yes. So did you get all my background about the use of this product with stem cells, or yes? Can you hear me over there?
Yeah, we can hear you. But the product background, we have a little information about that.
About what? Sorry.
No, the communication is still very bad.
The communication is
yeah,
still very bad.
we can see you in action, and once in a while there is a word we can understand, but that's about it.
Oh, sorry. So, did you hear about my background on stem cells and the use of cytocare as a media for my cells? Does everybody understood this, or?
I think we missed a lot. Maybe you can repeat your stem cell
Yes.
experience.
Oh, I told that I am working on in my research part on adipose derived stem cells since 2003, and you know, to use stem cells in humans or in animals for our experiment, we were looking for a media, an injectable media where you can put your stem cells in. So in order to find the best one, I took all product on the market, cross-linked hyaluronic acid, non-cross-linked hyaluronic acid, all kind of skin boosters, mesotherapy, and we tested, we assessed the viability and the proliferation rate of stem cells within each of these products, and that's how I knew about Cytocare, because that was the product which gives us the best rate for our stem cells proliferation. Is this clear for everybody?
If we understand you correctly, you have a medium
Yeah.
which is filled with stem cells. Is that what you're injecting now?
No.
No.
Here it's just the medium,
Okay.
but I tested this as a medium for my stem cells. When I do experimental study or when I do stem cells injection, Cytocare was the best media.
Okay.
So if it is the best media for cell proliferation, in my opinion, it's good to be injected alone. You know what I mean? Because it's not cytotoxic for my cells, and it gives all nutriment to cells for the proliferation.
Now we can hear you
Yes.
very well. What a
Okay.
relief.
Do you want me to repeat everything or?
So you're injecting a
I'm in,
yeah?
I'm injecting Cytocare, which is non-cross-linked hyaluronic acid. You have different concentration and 50 rejuvenation complex, including amino acids, vitamins, and this is Cytocare. This is the entity. But the way that I was introduced to Cytocare, because I'm plastic surgeon, so usually plastic surgeon in France are not using mesotherapy at all. I mean, this is, and the way that I knew Cytocare and I started working on Cytocare, that was my research part on stem cells. You know what I mean? I tested this for for as a media for the proliferation of my cells, and that works the best on the market. That was the best product for the proliferation rate of stem cells. So that's why I do believe that you can use in a local injection this product, and that will increase the proliferation of your cells. So that will induce a biostimulation and increase the quality of your skin.
Yes, we understand
Yes,
now.
okay. So
Thank you. So
Are you injection along each line, or what? Can
yes,
you explain?
yes. I am injecting in each line, so you can do small papilla and just press it, or you can do linear injection for each of them. Can you see clearly?
yes, we can. And do you do several treatment sessions, or is
Yes,
one?
you
Yes.
have to do several treatment sessions regarding the importance of wrinkles. So I usually and you have different concentration of Cytocare. So for young ladies or young male, you can use the 516 or 502, or for elder one you can use the 532, which is the highest concentration of hyaluronic acid. And I usually ask them to do every 2 weeks one injection for about 2 to 3 months, then once a month, and then just I will see the patient every 6 months at my clinic to check the evolution. But that really changed the quality of the skin, the texture, the lightening, and I have bunch of patients in my clinic. They come only for that, more for cytocare injection than for volumizing, product, hyaluronic acid or other kind of product. People come and ask for that because that really changed the texture of their skin.
I see you're also injecting the very thin area of
of the of the lower eyelid.
yeah, the lower
Yes,
eyelid. We were
yes.
just discussing it before you came on the screen. So you're pleased with the results there? Is there swelling afterwards? And
So for sure you have some swelling as soon as you touch the lower eyelid. The skin is very thin in this part. You have some swelling, but I am happy with that because this will disappear, so you will not get any Tyndall effect because of the HA, but that will make your skin thicker, and that will improve the quality of your skin. So, and you know that a part of the problem here is the loss of the volume, but it's also the quality of skin. The skin is very, very thin. So I am treating with full face injection.
if anybody in the audience wants to pose a question, yes, please.
Sorry, I cannot hear the question.
I would like to learn why you choose this new S line, not the 532 or 516.
Oh, this
What
is
changed?
no, this is just the ergonomy of the product. You can still use the 532 or 516, but this is already, you know, when you get it, it's ready to be injected, so it's easier. You know what I mean? You don't have to do any kind of manipulation by pulling in your syringe, and so this is ready to be used. So that's why I use this. But you can still you can keep working with the vial, with the 532 or 516. The product is the same. You know what I mean? Is just the form, the presentation will change. Any other question?
Please, you can use the cannula to inject this product?
Yes, you can, but you know, as it is mesotherapy, and as your goal is to touch the dermis and the epidermis to increase the quality. So this is a superficial injection, and with cannula you cannot do superficial injection. So theoretically you can, yes, but it's not recommended, because what you are looking for is to increase the dermis thickness and the crosstalk between derm and so that's why I usually don't use cannula for meso. Can you see exactly what I'm doing here on the lower eyelid cheek junction? So I do penetrate the skin superficially. I'm not touching the orbicularis muscle, and then I push and I undermine the skin with my product. Can you see that?
Yes, we can.
So I'm really superficial in this area.
You know, if I look from this angle to the eye that you just treated, it doesn't seem to be very swollen. The other eye.
No, thanks
No.
God, not.
No. You're a good injector.
Thank you. No, because you know during workshops you have sometimes some surprise. So no, she's not swelling a lot. That's good. So I have injected this part. I have injected. I will put a little bit more here.
Oh, it's okay, it's okay.
Can you go very close to the lower eyelashes?
Yes, you can.
You can.
You can.
Yeah.
You can.
Because we
Yes.
have this magnifying view now with, you know, the area just underneath the eyelashes
Yes.
that
Here.
seems to need some product.
Yes, yes, yes.
There.
Yes, you can.
Okay.
But then you will get more swelling and
Yeah.
more chemosis. But you can, because this product will not stay, so you will not get any irregularities because of the HA. And I have in my in our animal studies, we have a histology which shows you that you are increasing the thickness of the dermis, and you are increasing, you know, the healing process, the cicatrization process. And you all know that biostimulation starts by with the cicatrization process.
Okay. If it's okay for you, we are going to allow one last question. And then in the sake of time, I would like to propose to go to the next
Yes, okay.
demonstrator.
Yeah, doctor, did you use any topical anesthesia before doing this procedure?
Yes, I usually use topical Lido. Yeah, and she had lidocaine, but it's it is a 30 gauge needle with the liquid product, so it's not really painful. And
we-
for neck area and the décolleté, the cleavage,
Okay.
it really works very well. I have few patients that I totally treated with 6 or 8 injection, several times, and now you don't have any wrinkle in this part. I mean, it's totally, it totally disappeared.
I have another question.
Yes, please.
We most of the times around the eye area we combine the laser treatments.
Yes, this is good.
So is there a timing for you? What is your strategy about the timing in combination with this
Laser.
non-cross-linked hyaluronic acid
Yeah,
and the laser?
this is a good question. I usually, personally, I don't practice lasers, but I have a friend of mine, and I usually start by the laser. I usually start by the laser because of the ecchymosis that you can introduce with the injection. So then I also have this opinion that injecting Cytocare is helping you to heal. So I start by laser, or some of my colleagues do peeling, and then I do Cytocare injection.
In the same session, or
No, no,
you
no,
put
no.
1 week in between?
Yeah, 1 or 2 weeks, yes.
Okay.
Okay, thank you. I think for the time reason, we should move to another demonstration. Thank
Okay.
you.
Thank you.